Adventist pastor actually that helped sponsor me for Food for Life, and then Cornell, I got a scholarship. And I'm so glad about that. So I want to say thank you for that and for this opportunity, really. I always say and I always believe that something that I have to share is going to touch at least one person. But in this case, I hope it touches three. That it's 100%. I'll try to make it more personal, but I actually presented this at the national conference, the Prevention of Disease Conference in New Mexico. They asked me to speak because they've heard of the great outcomes that I've had helping families reverse their diabetes and have remarkable outcomes, and in 3 different studies that were done. And so they asked, and I thought, well, they had so many wonderful speakers, but they still wanted me to do that. So I said, okay, I'll share. And because this is really remarkable. So my work, yes, as Pastor said, has been working with the Latino community the majority of the time. They're very underserved, as many are actually today when it comes to this information. Are you familiar with plant-based at all? Not at all? Okay. All right, go. Well, even better. So I get to share this. So neither are my patients in the outpatient center where I was teaching. And so that's what I'm going to share. What you see here is my mother, Elisa Beth Gonzalez. So I put her on here because she inspired me when I started this journey over 35 years ago, when I became a nurse, a registered nurse, and became a diabetes specialist. Mom didn't get to know about plant-based. She never had the opportunity. So unfortunately, she lost the battle that many today have an opportunity to win, both on the prevention side and also on reversing diabetes and many other chronic diseases that are related to our diet and lifestyle today. So quickly, since we just have about an hour, that's a little bit of my bio. As Pastor was saying, you could look me up online. So this is my background working with this. The other person you saw there is my husband, Andres Rodriguez, who's the light of my world after God. God number one is my husband, and he is always helping me in one way or another. So I love to give thanks to him, and first of all, thanks to God for having me here. If it wasn't for him. Dr. Colin Campbell, I like to say thank you all the time because I got that scholarship thanks to him. I was going to show, and I have these links, and I could give to pastors so that you can access it. Adventist has a website where you can actually get this documentary. It's a quite famous documentary. I don't know anyone familiar with it at all. Would have loved to actually take this time to show it to you, but I can send the link, or a pastor can get that link to you. It is an amazing documentary which really gets to the root cause of diabetes, insulin resistance, and how it's so much connected to the food today, and not the food that we really should be having, but the food that we're accustomed to that is so connected to so many diseases, chronic diseases today. So at the national conference, they asked me to talk about 3 objectives. Number 1, what's the importance of family when it comes to the Latinos and this topic, and also what were some of the makeovers that they did, and I can talk about, we can adjust that, and then some of the research study that the doctors did when they heard about me. So I was the little rave at the hospital because they kept hearing about all these patients that were reversing their diabetes and coming off medications, and not just medications, but insulin. So they were curious. So after one study and another study we did, one small, one medium, they wanted to do a bigger study. So that's what I'm going to talk about at the end. What's diabetes? Well, whenever your blood sugar fasting is above 100 to 125, that's pre-diabetes, and when you're at 126 or higher, that's considered diabetes. We also look at the A1C as an indicator. So diabetes diagnosis is based on numbers, and that's why when the study and when I talk about reversing diabetes, we look at numbers. So you're no longer actually considered diabetic if your numbers are between 100 and 125 fasting, and or a 5.7 to 6.4 for prediabetes. You're pre-diabetic, and if you're under 5.7, you're actually considered not in the range of diabetes. Not to say that if you go back to the old lifestyle, you won't return to those numbers. But once you're out of there, you're pretty much considered reversing diabetes. Yay! And it can be done. So this is actually one of the families that, that gave me permission to share about, some, and this isn't just particular to the Latino community. All of us, love family and do well with family and are motivated by family. So this is, with them, it extends out to the grandparents, and grandparents are connected to the family, some oftentimes living together and helping each other out in a big way. The gentleman right above the sombrero was a very interesting patient who said, hey, I heard about that lady, and you know what? I don't want to be on insulin. His A1C was very, very high. It was at 13. If you're familiar with A1Cs, that's a very high A1C. Typically with that number, you're not just on one insulin, you're on several insulins, not to mention oral medication. He didn't want to take any injection, and he said, I want to see that lady. So, and he did not need the insulin. Just a quick summary on that one. Rush to the chase. So they came to a program with me. I'm a certified diabetes educator. Most people don't know what that is. It's a CDE. I'm board certified in diabetes now for 2 decades, besides being a nurse for 3 decades, and now over 5 years with plant-based nutrition. So, and I love working with families, although people are not always sure what I am. My family comes from Puerto Rico, and so there might have been a little Chinese person in there somewhere stuck around in the bloodline, because people often tell me that I look a little bit. So what really works with our program is that the family was included. So anytime that a patient came to see me, I encouraged them to come with the spouse and children. And this really did help, because one gentleman just told me recently how he was listening to what was going on with the wife as I was helping her and trying to include him, but he kind of just sat back. And then he called the other day, he goes, we need to continue seeing you. I lost 20 pounds just listening to you. I said, so this really works. We got to keep this going on. And so patients are encouraged to do that. And another thing that really worked well, and I'll be mentioning this over and over, is when we all share. And I call the people that graduate from my program and actually reverse their diabetes, I call them graduates or champions, and I celebrate, and I get really excited. So you might see me clapping in a minute, or I get really, really excited when that happens. So these were some of the strategies that helped and still help today, regardless whether you're Latino or not. This is important, including families, encouraging them whenever they do well. But when it comes to the Latino family, it is especially tragic because in America now, the U.S. is saying that 1 out of 3 are going to, develop diabetes, and everyone's in a panic. Oh my, 1 in 3. But when it comes to Latino and African American, we're 1 in every 2. So if we're panicking about 3, imagine 1 of every 2 of us getting diabetes, and it's predicted that it's going to come at a younger age, and these children may not even live the age of their parents. Now that's a tragedy. I'm a grandma, and those 2 beautiful girls you see over there are my granddaughters. So I try to stick them in here to keep me on track as to my goal, and working with families. And champions are anyone that lowers an A1C at least by 1 point. And these families, on average, were lowering their blood sugars by 3 points. And blood sugars were lowering at least 300 points, and losing weight, lowering blood pressure. These are some of the graduates that agreed to be present here. And I said I would show them off. Here we have an A1C of 10 going down to 5. His blood sugars dropped from the 400 range to the 100 range. And he's still on his journey. He's about 90% vegetarian or plant-based, which means once in a while he may have a piece of fish on a weekend or so. And I think last time we spoke, he's not even doing that anymore. I said, if you eat it that little, doesn't seem you like it very much. Why even, you can get all the protein and nutrients and micronutrients, phytochemicals in your plant foods. So we need to change that. But that is Sidonio. His mother, unfortunately, had lost the battle. That's the lady you see on the top. She lost her battle at the age of about 50 to diabetes. She got an infected foot, didn't look into that, didn't control her blood sugars, and turned to gangrene, and she died at the hospital. he was devastated by it when he saw his numbers in the 400s. And the doctor did say he also needed insulin, but he'd heard about that lady, Nancy Rodriguez. Where is she? And he came to every session and brought his blood sugars, brought me his food records. So I do classes, I do consultations, individual and group. Saw him for 3 months, and the numbers are phenomenal, phenomenal. What you see here, this happened in about 3 months' time. This is just unheard of. It's unheard of. I don't know anyone, if you're familiar with A1C, this is just amazing. Anna, another young lady, she was on 4 insulins initially. They thought she was type 1. She went from a 10.8, you can't see it very well there, but to a 5.7. A year later, we got in touch with her to see where she was at, and she was at a 5.1. She was taking off all her insulin within a month of being in the classes. This is powerful, 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 powerful. So they asked me, well, how'd you do it? Well, I start off with the plate because for most people, it's difficult to just embrace this right away. So they've got a choice. They can start with the myplate.gov because it's already almost 70% plant-based. It tells us, even from the government, that we should have fruits. Well, we definitely should have fruits. We should have fresh fruits, of course. Vegetables, very, very important. Grains, whole grains, absolutely. And when it comes to protein, they no longer say meat. Yay. They say protein, because protein actually is in all of our food. And so it's all in there. It comes as a package. And so I tell people, well, you know, it doesn't say meat. It says protein, and there's protein in everything on that plate. And if you want an extra boost, beans have at least 7 grams of protein per half a cup. So you get plenty of proteins in all of the food. It's packaged in there, you know, but beans will have some extra. So if you want to follow this plate, you're almost 75% there. And dairy, we don't need, you know. Baby kittens drink milk from their moms, calves from the cow, we from our moms. You know, we just don't see, you know, men today, you know, drinking from a cow. We don't need that dairy. And there's actually studies referring to casein in milk and cancer. So do we need it? No, we can go with non-dairy milk. And there's also calcium in beans and in, you know, in our greens and many of our foods. So we do not need to have dairy per se either. It's like, whoa, did she just say that? Absolutely. So we start there, and then I introduce families to consider, you know, if they want to switch off the dairy. Not only do we not need it, you know, because of the casein, but it also is loaded in cholesterol and fat, and thankfully, some Latinos and African American, we have lactose intolerance. Yay! So it kind of gives upset stomachs and constipation, so people are often even glad to give up the dairy. It's not a big deal. They thought they had to have it, and you do not have to have it. So then I introduced them to the Power Plate, the Food for Life Power Plate. And these are some resources you'll see again in a little bit that I have here today in Spanish. They're also available online for free in English. So you go to PCRM, and you'll get that booklet. There's fiber handouts. There's a 21-day kickstart, which if you sign up in the first month, they will send you the recipes for every day for 21 days to your email for free. So that is amazing. They're also one of the only organizations in the world that I know of, and this pastor knows of another, that has information like this in Espanol for the Latino community. So I love PCRM for that. And it is all free online. That plate you see on the far end there is a plate that I'm still developing, color-coded to help people, you know, maneuver some of the foods and so forth. And then there's that Power Plate that I talked about a little while ago. That is the main teaching that I give because really this is all we really need to have a very high nutrient-dense you know, foods that are going to help fight disease. A very powerful Power Plate. So a very adequate name that goes with that. That's just perfect. And so, and then there's forks over knives that I recommended. So in this study, I recommend all these resources, and I would do some cooking demos as well when I was able to, and then you know, referred people to all of this and my culturally prepared Power Plate. Right now, thanks to Pastor Bardan, Gabriel, we're actually doing some classes at his church. So that's wonderful, through a grant through Charles Schwab. So we are able to provide, my husband and I, those Food for Life classes. And they're either 4 to 8 sessions, and they're on different topics from diabetes, cancer, weight loss, and so forth. So that's another resource, and this kind of gives you sort of an outline of that. We do grocery, we do meals, we do recipes, lots of fun. And there it is again, there's our plate. So it's that simple. I mean, it's this simple. Can you imagine? People coming off medications, off insulin, losing weight, lowering the cholesterol. I mean, just amazing, but how simple it can be. And I know it's a little bit in Espanol, but the picture kind of tells you, right? And here it is in English. So what is it? What are you talking about? Well, it's a low-fat, nutrient-dense, plant-based diet with whole foods, high in fiber, unprocessed or minimally processed, excluding all animal products, including meat and dairy. That's simple. No oil. The one thing that is missing, we don't really need any other vitamins unless your doctor says there's a deficiency. The one thing that we do need is the vitamina B12. B12 vitamin is the one supplement that is encouraged. And then again, here's some awesome handouts that are also available. And I go over again just to be very specific when I talk about fat, and we're talking about giving up the lard and the butter and the oil, which oftentimes people are surprised. What, you mean oil? I thought it's healthy for me. I thought it was good. Well, it is not. We do not need oil at all. And and then the carbohydrates that raise our blood sugars on this end, avoiding this extra added sugars, processed cereals, white breads and sweets and so forth. And then enjoying everything else to your right. Vegetables again, fruits, legumes, our beans, all sorts of beans, just remove the oil. And grains, of course, whole grains, like our oatmeal and all of our grains right there, as you can tell, brown rice and barley, quinoa, millet, etc. So again, without the oil. We can get everything that we need from our plate, from our plant power plate. We really can. Whole foods, plant-based, low-fat, minimally processed. So we go through substitutions because people are like, well, what do I do instead of my meat? So we talk about, in the transition, some people start with veggie burgers and some other transitional types of food. So we do talk about that for those that really struggle. Well, I really want to have my burger, or I want to have my hot dog, or what. So we do talk about that. And then egg substitutes, how to do that. So this is actually not as hard. And milk. Some people still do like milk, and so there's soy milk, there's almond milk, unsweetened, organic. You can make it, which is even better. So that's a lot of fun, making your own milk. The first time I did it, it was just so exciting. And when people see me make the walnut milk, and they're like, wow, I didn't know walnuts could turn to milk. Have you seen it done? It's amazing. And then I go over the fiber check. So how much fiber do we need in a day? 10, 20, 30, close, 40, at least 40. Now they say 30, and my patients who help reverse diabetes, they've went up as high as 50 to 60 grams of fiber. The more fiber, the better. And fiber is only found in plant foods, yes, whole foods. So it is not found in animal products. If we had time, I was going to show a little bit of this great video on the Hispanic paradox and Latinos and beans, and how tremendously helpful it is. And then this handout that explains again all the great benefits that we get from beans and how to cook them and prepare them and have them. So this is again what you would get in our Food for Life program. These are some of the resources. And here's one of our graduates. He was one of my very first 5 years ago. And wow, yeah, isn't it? Isn't that amazing? He was very courageous to do this. Because when he came to me, he had also heard about me. I was also invited to a church like this in the basement, and they said, she's coming. And he told his doctor, I do not want to take those injections. My brothers are all on insulin and everything else. I don't want to do that. So can I try this? And I said, it's up to your doctor. Your number's really high, and I have to respect your doctor, but I'd be more than happy. So we did. And he did. He lowered his A1C 5.7, but not only that, he lowered his weight, as very obvious, and his triglycerides were in the 300s, and they went down to 59 in about 4 months' time. He lost about 60 pounds or so. Amazing. And he's not the only one. I mean, there's thousands around the world. I mean, this is phenomenal. I call it the new tsunami, a good one, that's coming. So get on that wave and get in touch with this, because it is amazing. And so I share the stories about the things that he did initially to change. And in the Mexican community, there's this thing called the sweetbreads, but we all have cakes. We all have some sort of sweets that we all love. And he used to eat that once, two times a day, sometimes more often. He switched from that to fruit and started to develop the taste for fruit. Once you give up all this processed sugar and fat, the body may go through a transition, but once you're away from it for a while, the body now starts to appreciate the taste of fruit. And it tastes like, the sweetest thing you've ever had. Believe me, yeah, it really, really happens. And he used to eat a lot of that pork and all kinds of, fatty meats and red meats, as we all, usually in our culture now. He switched to more salads and to more beans. And tortillas, he used to have 2 to 3 dozen, and he changed to about 3 a day. So these were some dramatic changes for him and his wife and his children. Here is Rosalina. She made very similar changes that he did. She's the grandmother in the house, so she started to teach this to the family. And these are some other typical foods that were, changed with other, not just the Mexican community, but also some of the patients that come from a Puerto Rican background. Because food is so connected to family and love, right, and celebrations. That's why it's so important that the whole family understand that it's not just for him or her with diabetes, but they can also prevent diabetes, lose weight, lower their cholesterol, prevent a heart attack or stroke. So again, these are some of the foods that are common in the culture and some of the changes that were made. And beans was interesting. They started to appreciate in the culture their beans now as part of a great substitute for meat. They're getting a lot of protein with that, and so they started to see and appreciate beans again in their culture. These are a lot of the similar common drinks that they would drink, very sweetened, very processed, very unhealthy. And now you see some of the recommendations. Number one is water. We really need water. It's the number one thing we need. But if they wanted to have some tea, we actually recommend green tea. It's very great antioxidant tea, but if they want to have a different tea, that's fine, as long as it's unsweetened tea. There's tea de Jamaica. That's the one you see on the bottom, a common tea in Mexico. So they started to appreciate that tea that's theirs as well. So changes, gradual changes in all of these types of foods that they started to incorporate, and instead of frying the tortillas, they started to bake them and cut them up and bake them instead of fry or buying the salty fried. And cheese, you can actually make cheese with nutritional yeast, and teaching them how to do that, or enjoying their guacamole and salsa with their baked chips. So this is just talking about the study, one of the first studies that was done on the work that I was doing with patients. And these are some other results that we were seeing with them as well. So you see the numbers continually going down. Blood pressures, many patients didn't come with very high blood pressures. They were on medications, and they seemed to be working for them on that. But most of the patients that came to me had very high blood sugars. The weight was an issue, and the cholesterol was an issue because of animal-based foods. So now, thankfully, we have the American Diabetes Association now came out with the new medical standards for 2017, and they now say for the first time that plant-based or vegan vegetarian is part of the plan that they recommend, the meal plan that is highly recommended. So this is exciting for us in the field to see this. It's also coming from the American Association of Endocrinology, that the very first thing that's recommended is plant-based meal plan. Yay, so everyone's getting on board, from the American Association of Endocrinologists, the American Diabetes Association, the American Academy of Nutrition. They're all getting on board. As long as it's an appropriate plan, vegetarian diet, including total vegetarian, vegan, healthful, nutritionally adequate, that is definitely known to help prevent and treat diseases like diabetes, heart disease, and even some cancers, which is a studies that was done with PCRM. Dr. Neil Barnard did a study on this that showed how diabetics were able to improve dramatically their diabetes, in some cases reverse their diabetes. So this is a study that we did. These two doctors kept seeing how the patients were doing so great. That's me several years ago. And they said, wow, Nancy, we want to see, we understand those studies were done. Let's see what happens when we compare our patients in the clinic to your patients that you're seeing in the office. Which I thought, okay, well, that doesn't seem fair. That's 2 to 1. That's 2 of you, 1 of me. And you guys are working, and they wanted to study the patients that I had already seen and compare. Initially, I was a little hesitant. I thought, I don't think that sounds very fair. But, okay, let's look at that. So the objective was to show the benefits of a plant-based diet in the Latino population, and see what happened with that. So, yes, well, let's look at that. They want, the hypothesis here was, does it really work? Can we see this? Do we see that A1C coming down? Now remember, every time an A1C comes down by 1 point, every 1% decrease in A1C lowers your risk of complications by 30 to 40%. So for every 1 point, so that's 1 plus 1 plus 1. So typically, where we used to be happy, oh, we got them to lower 1 point. And most doctors today, that's the goal. If you can lower 1, that's good. Most medications will barely get you down 1 point. But can plant-based diet do any better? Especially over there with Nancy all by herself, and the 2 doctors working with their patients. Well, it was a retrospective study. We went back to look at, and these are the people that were looked at, 30 and over, male and female. There were more male than female, and A1Cs over 6.5. So I was initiating at the time, again, the Food for Life program, and I was developing this Latino plate, just putting in the plate the foods that were very culturally relevant to the plate. So that's my plate on this side as well, as PCRM's plate. And there it is again, the power plate. And as you can tell, very simple. Natural plant foods. You know it's a natural food. It grew from the ground. It doesn't have any packaging. It hasn't been changed. So you just have to bake it or steam it and or eat it raw. So I initiated the classes with these patients, and I had done it for a while already. And so they were studying the experimental group, which were the whole foods plant-based patients that I was seeing that were diabetic, and then they were working with patients that were not in the group. And they were trying to do their own nutritional recommendations based on the ADA guidelines or giving medications and so forth. Where with me, oftentimes, what was happening is that patients were coming off medications. So that's why I thought it was unfair, because they could always manipulate their end and just push more medications. Now listen, this is so powerful that patients would often get low blood sugar, shaky, and we had to get them lowered off the medication, oftentimes coming off diabetic medications, blood pressure medication, and even insulin. And that was very exciting for me, because after 35 years in nursing, it was the first time that I had seen patients come off insulin. Have you ever heard somebody come off insulin? I mean, I haven't either, and that was 35 years of practice. So men responded better. We weren't quite sure why, but in the Latino culture, men rule. So, you know, our guess was that, you know, if they said, hey, you know, we're following this plan, okay, and the wife would follow along. Whereas if a woman decided she wanted to do this, but the husband was not, there were struggles there, to say the least. And so men did better on this than women. But look at that number there. I know we don't have a pointer, but I just have to point to it. That was shocking. That even surprised me. I was hoping for at least 2% drop in the A1C. On average, it was 3.28. That's just amazing. And so the doctors were amazed. They started following the plan. They started losing weight. I mean, it wasn't just the patients being influenced. The control group, they lowered as well. I mean, they did lower with all those medications. They had extra medications added. They didn't come off any medication. Instead, the medications were added, which are quite costly. They took longer to get to that number. They took 5 months on average, and they lowered 1 point, which is still good. I mean, that's the standard. But imagine lowering almost close to 4 points and getting off medication. That's just phenomenal. So now I know I'm running out of time, so I'm just going to go quickly through the graduates. This is my favorite part. Again, Carlos, remember Carlos in the beginning? He had lowered to 5.7, and then a year later, he was down to 5.1. What does that mean? Well, remember, we said the diabetes is, prediabetes is 5.7. That's the cutoff. So if he's not even there, he's at 5.1. This is amazing. Roberto as well went from 12, you can't see, but then he's down 6% as well and came off. So to me, can you tell why I'm so excited about this? I am so, so, so excited. And now finally, I want you to meet Mark Ramirez. Now, Mark Ramirez has a really amazing story. He watched Forks Over Knives. Promise me. Who promised me you'll watch Forks Over Knives? You raised your hand first, so you're getting the video. See, there was a thing to my thing. Okay, so you promised I will be checking. I have angels that, no, I'm just kidding. But Forks Over Knives, and there's a link, thanks to the Adventist Church, God bless them. There's a link that you can get that if you don't have Netflix, you can actually watch it through the link. And he watched Forks Over Knives, Mark did, and I called him today. He gave me permission to share. And so he also read the book, Dr. Neil Barnard's book. I believe this one is just a few minutes. How many minutes do we have left? If I would like you to hear from him directly. It's only a few minutes. I have half an hour? Okay, good. I know you're kidding. Oh, uh-oh. Uh-oh. Oh, no. Oh, no. What happened? Oh, I have no internet connection. Oh. Okay, well, let me tell you. I wish you could hear him. Well, there he is. Mark is my hero. He's out in Michigan. He had heard about me. I'd been doing this for a while, and he wanted to meet me and wanted to come out here and do some projects. And I said to him, Mark, you have an amazing, amazing testimony. You just go share that testimony. That's what I do. I grab my champions, and I grab a doctor here or there, never really can find one, and then me, and we do it. So, and sometimes, often, I do it by myself with a champion. But you are the champion, and you have doctors that are plant-based, so do your thing. I think you'll do great, and he's doing phenomenal. Because his testimony is so extremely powerful, I'm sorry that we can't hear it. What happened is that in his family, this is very tragic, but in his family, everyone was diabetic. His mother died at a young age, also in her late 50s. I believe she had a heart attack and amputation. Another brother, amputation. Another sister, dialysis. Another brother, blind. I mean, it's the worst, and he gives it in the testimony. You can get him online. Look, Mark Ramirez, Forks Over Knives story. And then he's actually on a new release right now, a new documentary called Eating You Alive. So she shares his testimony there, because it's just so tragic, so sad, but so amazing at the same time. Because Mark, when he read about reversing diabetes by Dr. Neil Barnard and saw the Forks Over Knives, was so motivated that he did everything that was, gave up the meat, gave up the junk food, gave up the soda, gave it all up, and started to eat the whole foods, plant-based, unrefined, unprocessed, no oil, no fats, no junk food. And lo and behold, within a month, his A1C went from 10.8, I would believe it was, to an 8 within a month. That's amazing. And then 3 or 4 months later, he shows his lab results. They're in the 5s. Applause. Oh my God, amazing, amazing. He lost a ton of weight, as you can tell. And now he shares his testimony all over the place. He's just an amazing guy. What happened? There he is again. This is before. There he is after. Isn't this amazing? These are all the medications he was on and the injections. He is medication-free. Isn't this amazing? He's in this new documentary. So if you can get it, I highly recommend it as well. And I also had a link to it, which I also can't show, but I wish I could. But it's called Eating You Alive. You want to get that one. And then there's all these links that I wanted to share with you, if there's a way to share it later, which shows, Sanjay Gupta, the Forks Over Knives documentary by the Adventist group, God bless them. So I just collected a lot of, there's Mark Ramirez's, so I can share all of those later somehow. Pastor, show me. Huh? There, okay. Well, look, I think I'm actually in time. So all these beautiful people, that is again my mother, Elisa, who inspired me to become a nurse and also become a diabetes specialist. And then unfortunately she lost her battle and never got the chance to know about this information. So I hope you will take it to heart. How many think they might do this? All right. Okay. All right, I told you I've got angels running with it. I got Pastor going to be checking up on you. That's my grandbaby. He's part Serbian and Latino. That's our little Bronco right there. That's my honey. That's our other granddaughter and grandson out in Japan. And our granddaughter trying out kale. So there's hope, ladies and gentlemen. There is hope. That is all for me, and I believe I'm right on time, which is amazing. I actually have. Oh, I thought you were kidding. Oh, 10 minutes? Oh, would you? Oh, Pastor, don't get me excited like that. Well, I just wish we could show that video, that little with Mark. But again, I just want to end by saying nothing's impossible with God, honestly. With me, I mean, our family had diabetes, right? So my younger sister decided, we became a pilot study, right? Because my sister, I begged her to try this. And she said, absolutely no way, She loves her McDonald's and Burger King and Pizza Hut and all her foods. And she said, absolutely not. I'm the oldest, so according to, medical, histories here, I should have been the one with diabetes, heart disease. My mom had the thyroid, the heart disease, she had open heart surgery, she had it all. And so I should have been the one. By my age right now, my mom had diabetes already at least a decade and was on a dozen medications, including insulin shots. I'm not on one. None. Glory be to God for his plans. So I know they call it the power plants, but I'd like to adjust that and say that these are God's awesome plants since the beginning of Eden. And I thank God for this because they are truly powerful. When we incorporate natural whole foods, steam them, cook them raw, eat those greens and eat those beans and, a couple handful of nuts and eat this natural food and stay away from processed white breads and white rice and switch to the brown rice and switch to the whole foods and sweet potato, baked potato, take out the oil, no more butter, no more lard and oil, and switch to God's natural foods for our body. It is amazing what can happen. So you can get that 21-day kickstart that I told you about. Click on there, and Pastor will have that on his site. And they will give you the menu of the day. And you don't have to eat all of it, but pick and choose what you like, and then put a star by there. And then next day, maybe you'll find something else they give you the recipe, the menu of the day. Won't hurt. Maybe you do it once or twice a week. Maybe you choose to do it every day. How many would think they might do it? Okay. She raised her hand. You're going to have to get the power plate. I told somebody. You know what I was up to, right, with that question. There's a trick. There's a method to my madness here. Well, please, like I said, all of this is available online as well. I thank God for PCRM as well for having these great resources. And 21-day Kickstart, Vegan Kickstart is free online, English and Spanish, Chinese. I think they got several languages out there. And they're free. Many of these resources, you can get them as a link as well. And then I have that available as well as links with several other great recommendations and other great speakers out there as well. So this, I just have to say, this really works. Give it a try, even if it's just one meatless Monday. Start with getting rid of the meat, get rid of the milk right away. As we said, there were studies by Dr. T. Colin Campbell with casein being, correlated with cancer. So we don't need milk from a cow or a duck, or a dog, or a cat. We don't need that milk. I know it's funny, but we don't need their milk. We don't need their milk. We can, get that walnut. Get 4 walnuts, put a cup of water, and put it in your blender, and you'll thank me. So you can make your own. You can Google that on YouTube. You can buy, almond milk, unsweetened, organic, soy milk, the same thing. But you get everything that you need. God packaged it. Oh, thank you, God. Everything that we need comes in the foods that He's prepared for us. And it's all there, all the nutrients we need, the vitals, the phytochemicals, the minerals, they're all there. We just have to incorporate them, maybe little by little. My time's up? Oh, I thought I heard you. Oh, okay. Boy, that was quick. Yes?
If someone will not be able to attend your seminar or program, and they would like to do it to start by themselves, are there any resources online?
Oh, absolutely. There's several.
What would be the first steps?
Well, the first, 21-day Kickstart I think is awesome. A lot of people, there's even an app for it. 21-day Kickstart app. So Google 21-day Kickstart app. Google it on your phone. Do you have a smartphone? Okay, you can do that. Secondly, there is an amazing other resource, but it's not in Spanish, which is fine for you because it's Diabetes Undone. So the Diabetes Undone is another amazing resource. I don't know how many videos that you get. For the minimal price, I think it's $50 or $140. You get like 20, 30 videos on this topic, and they're beautifully illustrated. You get a book with it as well, and a book and a recipe book and a workbook. I mean, it's just amazing. So that's a program in the future that I'd like to start to do, as well as the Food for Life, and that's Diabetes Undone. So you Google that, and there's a great doctor by the name of Dr. Schaumburg. He's got a book out as well, and it's called Goodbye Diabetes. It's one of my favorites. And then there's Brenda Davis. She's got a great vegan book out there as well. So there's tons of books. You could start, like I said, with PCRM's resources. They give you the menus, the recipes. You get them right on your email every day. They send them to you every day. Or you can if you love videos like I do, you can try to get in touch with the Diabetes Undone program. They may have a program in the area, or someday I hope to do one. I love that. That program is just amazing. The videos are amazing. And Dr. Schaumburg and Brenda Davis put that together. And it just goes step by step, teaching you and guiding you. And just teaching you right there online. And then that program that you have there, E for Diabetes Solutions, is an online telemedicine group that I'm a consult on there, and Dr. Schaumburg's on there as well, and Brenda Davis is part of that group. And so if you want to get in touch with us for that program, you don't even have to leave your home. In the luxury of your living room and your robe, you can be in touch with us, and we can be helping you with diabetes that way as well. So that's another way, even easier if you wanted to access that program. That one does cost. The PCRM resources, those are all free. And then Diabetes Undone, there's a cost for that as well. But those are the 3 best resources that I know of, that I love, that I use. And then there's this club. Amazing club. That's my first time being here, but I think it's wonderful that you put this together. So you've got this resource. And you've got my number. My number's there. So if I can help you in some way, you feel free to give me a call as well.
And if you were to try to gradually get in this and you took 2 days a week and said, I'm just going to eat, I mean, that's going to help you, even if it's just 2 days.
Anything. I tell my husband, as long as you're trying to move forward. People say that they struggle with this. So I say, at least start with the worst meat of all. I mean, we know that the World Health Organization talks about red meat and cancer. So some people decide, hey, let me just lay off that red meat, right? So they start there, and they get rid of the red meat, and they do that 2 or 3 times a week, and then plus they save money. How many of us like to save money? Okay, all right, good. So it's expensive, plus it's bad for the health. So they start with the red meat, and then, as I said, they start giving up the dairy, which is also a great thing to give up right away. So those 2, if they can do they do that, and then they could go to substitute meats if they want, or just go with the beans and substitute the beans for the meat. And again, the recipes that are on PCRM give you there's at least 3 menus, and there's 21 days, so 5 times 21. How many recipes is that? that? That's a lot. So you can pick and choose from any of those. I have a Facebook page as well that I put some information in there. I try to put mostly Spanish, but it's Spanish and English. So you have my information on that as well. So there are tons of resources really out there. When you look at plant-based, there's a lot of support groups. There's a lot. And it's wonderful that you have this one available to you here as well. But and then again, I gave you some of the resources. This one tells you and gives you a good testimonial and walks you through some of the steps to take. And please talk to your doctor and let them know that you're doing this, because if you are on medications, the one caution is that the doctor, you need to work with your doctor and let him know, I'm trying this. I met this amazing educator. No, just kidding. You don't have to say that. But if you do, you get an extra video. No, just kidding. But you could say, she really, I think I might try this and give it a try 2-3 times a week. Not to mention my health, but my pocketbook will thank me as well. And then take it from there. And then people start with 3 days, then eventually they go to 4, and they realize, hey, this isn't so bad. And before you know it, we're fully whole foods, plant-based, 100%. Yay! Oh, please. It looks I still have time.
On the good side, I saw salmon. It was on something earlier. I saw salmon. Is that something?
Oh, that was something they were changing. So as they were going through the transition. Right, so all meat has cholesterol, and many of the fish that we get today also, come with chemicals and medical. So we don't need any of that. We don't need the fish. But what happens is that people switch from the red meats to fish. So that's an okay alternative, but remembering that we don't need the fish either, that we're going to get everything we need that promotes health and prevents diabetes, heart disease, and cancer, which are the 3 big killers today. We can prevent that. And hundreds and thousands of people are doing this all around the country and around the world. The longer lived people, and you could Google blue zones, the longest lived people that live over 90 to 100 years old, they have no diseases, are running around up and down, do not eat any of this animal products. They are mostly 90 to 100% plant-based. No meats. So if nothing else motivates you, living to 90 to 100, how many want to do that? That's fair. What? There you go. So see? So the blue zones, Google that. I almost put it on there, but I thought I would run out of time. But there's just so much it's so many benefits, so many. Organic is not as important, but if you want to go organic, that's fine. The most important is animal food. Some people think of it this way. If my refrigerator is full of dead animal, death equals death. It's just that simple. Life foods, life.
Good analogy.
Yay! That's simple. We can remember simple, all right? So I just pray that you'll try it. How many say you'll try it? Oh, okay. How many say? Okay. Who was the one with the video? No. Honestly, you will thank. And one of the biggest things a patient once told me, a gentleman said, hey, I'm so glad, he overcame his impotence. A woman said, she overcame constipation. It's just, one of the number one medications is for constipation. She says, oh my goodness, I'm embarrassed to tell you this, Nancy, but I'm going to the bathroom every single day now. I no longer have that problem. I am just, and she was losing weight, but she was able to go to the bathroom. So, so there's so many benefits. Others, I've got so much energy now. I'm off all those medications. Thank you. Today I kind of did a little bit, I was just putting some information out there that I was available, and tons of people on Facebook now want to know, where are you, Nancy, where are you? I'm like, oops, because people are getting it. They don't want extra medications. They don't want heart surgeries. They don't want, all these things that are related to animal-based dead foods. Dead equals dead. Live foods equals life. Yeah?
Yeah, I'm with you.
Makes sense. Hey! Don't worry, they're not recording. But I thank God. I do. I want to end by just saying, thank God, and thank Genesis 1:29 and Eden, the garden. Even when God created us, He created the best food for us, and we really should at least give it a try. Amen. Amen. Thank you, Pastor. Thank you for having me. I came through the flood.
It's not me, I'm not running this club.
Oh, well, whoever ran the club, I thank Silvia out there. I came through the flood. There were accidents, and I said, no, I'm going to make it. I always feel that one person's going to get this at least. Don't you?
Yeah, it's true. Has there been a lot of correlation with changing to plant-based with and cancers?
There have been some cases with cancer, but the main ones are diabetes and heart disease, and the ones that are killing us quicker. But yes, because remember casein, the huge study, the China study. You want to read that, and the relation between, as I said, casein, which was the milk products or the dairy. So if there's one thing that you could at least start with, you do not need dairy, cheese or milk or ice cream. That's an absolute. Let's get rid of that. There's so many non-dairy substitutes out there, and red meats. So definitely, if we're giving up the foods that are the most correlated with cancer, what do you think is going to happen? And that's already been shown in studies. So it's a huge correlation between switching from dead animal foods to live foods and reducing the risk of cancer as well. Many forms of cancer. Prostate, breast. Absolutely. Absolutely. Good question. Sí se puede.
You were wonderful.
You're awesome. Oh, give me a hug. Thank you. So the flood was okay to come through. I feel like, was it Noah? No, I'm just kidding. Oak Park. My husband wasn't feeling good. We had so many things going on, and I was like, oh. But I gave him his beans and his veggies, and he perked right up. Food is medicine. Hippocrates said that over thousands of years ago, a father of medicine. Let food be thy medicine.
Do you usually use dried beans, dried lentils, and grain?
I love all sorts of beans. I love my peas as well. They're all awesome. The key, no oil. Just please remember, no oil. Nada. Can. Yeah. Try to get them unsalted. The best, of course, is if you make them without the can, right? Number one, that's what we want. But if you need to get them canned, then get them BPA-free can, number one, and no salt added. And then you can rinse them just for extra sake, but no salt, BPA-free. Jeff Novick, he does recommend. Some of us, that's what we have, that's what we can do. But if we can soak them and make them, you get more for the buck, and they're better. But if you can't, and you can go canned, then BPA-free, unsalted. Good. Well, thank you. Gosh, I was afraid I was going to go over. Thank you. Oh, thank you. No. I'm happy to teach. Like I said, one, but see, I got three for one. Well, I mean, if we count the three back there. Yeah, you spread the word. That's right. Yeah, well, I said all these resources, Pastor will have them, and then you could please pass them on to friends. That's what I love about it. All those links for Forks Over Knives and all the links that I'm going to be sharing with him, you can look at them yourselves, and then you can also pass them on to other friends and family.
So, would it be so kind as to save this in a PowerPoint presentation so we can upload it on the website?
Uh-huh. I'll try to figure that out. I'm not very techie. But in New Mexico, they gave me something called a mega file and then how to switch it, and so I'll try to figure that out. They got me to that. But at the very least, I want you to get all those links. So, because everything is there, yes. The rest of this is the research and the studies that I did that I presented in New Mexico, because they insisted on learning about this Latina, because there's a lot of wonderful doctors. I mean, there's T. Colin Campbell, there's Dr. Clapper, there's Michael, nutritionfacts.org is another tremendous resource, nutritionfacts.org with Dr. Michael Greger, where he talks about all the research out there on just about every topic you can think about, and he answers questions based on the research and how it relates to plant-based and preventing disease, so even cancer. So he's got every single topic, on there. So those links are going to be worth it all. So the rest of it, I don't know that you need as much as you do need those links. Those will be the most important. And I'll make sure Pastor does get that. Because if you get that, then you can click on all those videos, including, thanks to the Venice Group, you can click onto the Forks Over Knives and watch it directly from anywhere. You don't have to be on, what's that, Netflix.
Yeah.
So thanks to them, yeah. Yeah, but baby steps are fine. Just start, review that that research, and there's some recipes on the back even of this one, and it gives you like a breakfast idea and a lunch idea menus right on the back. I believe they're all the same. This is the Spanish one, but the English should be
Yeah, the English.
right. So you have that on there as well. So it gives you some recipes. It explains the plate on there again. So you actually have my presentation on here. You already have it in writing. What you don't have on here are the links, and I'll make sure he gets that
Okay.
so that you will
so
get that.
much.
You are very, very welcome.
Thank you so much.
Boy, this is the first time I'm actually done on time. Oh, did I say? No, erase that part. Anyway, hopefully they'll erase the whole thing. But thank you so much for coming. Oh, wow. You made it worth it. Thank you, thank you. Thanks for putting up with my English. I teach so much Spanish. I think